You speak English, don't you?
Hi. Yes, I do.
The nurse told me that you have an accident and hurt your elbow.
Yes. Some hat hit me with his goddamn surfboard, and now I can't stand the pain. I swear, when I get out of here, I'm going to sue that bastard.
Okay. The important thing right now is to get better as soon as possible.
Yes, of course.
Okay, let me see your arm.
Okay, but be careful. It hurts like a mother. Ah! What the hell are you trying to do, you animal? Rip my arm off?
I am sorry, but I have to move the arm around to see how hard it's badly.
Well, be careful. For Christ's sake.
Don't worry, I am going to give you a painkiller right now.
What kind of painkiller?
I will give you some tramadol.
What's that?
It is a mild OPA.
That won't do anything. Why don't you give me morphine? That's the only thing that's going to help with the pain.
We will start with tramadol and see what happens.
Well, all right.
Hello, Monsieur Gilles. Good afternoon. I'm going to take you some Tramadol for your pain.
Okay.
It's okay? Well, I hope you feel better soon. Okay, doctor?
Thank you, Maria.
You're welcome, doctor.
As soon as the pain lets up a little, I want to do an X-ray.
I don't feel any relief.
Wait a little while. Be patient. In about 20 minutes, we will see how it goes.
In 20 minutes, I will be dead.
Nobody is going to die here, not on Dr. Bones' watch.